I am thrilled once again to have a special guest on the podcast who is absolutely thrilled to help us optimize our health and to advocate for ourselves as patients. Dr. Lucy McBride is a Harvard-trained internal medicine physician. She's also an author who specializes in preventative health, patient advocacy, and mental and physical health integration. So she blends evidence-based medicine and practical lifestyle interventions to help people take control of their health. That's what I want to do. I want to be the healthiest version of myself going into my 50s. Well, I'm in my 50s, going into my 60s, 70s, 80s, and beyond. I've had a look at her upcoming book called The Empowered Patient. It looks really interesting. It looks like it's set to come out sometime in 2026. So we look forward to that. Let's welcome Dr. Lucy McBride to the podcast and dive into helping you optimize your health. Lucy, welcome to the podcast. I'm glad that you're here. I learned about you through your Substack, and it's lovely that so many physicians and experts in their field are taking to Substack to present their content. I almost feel like it's a little bit more not serious, but maybe more trustworthy than sometimes that when I look on social media and see certain posts. How did you get into Substack?
First of all, thanks for having me on the show. I'm delighted to
Yes.
be here. Secondly, the reason I write on Substack as a primary care doctor and as a physician who sees patients every day, including a few minutes ago, is because it's so clear that people in this country are starved for fact-based information with context around it and
Yes.
for medical guides they can trust. Now, I'm not saying I'm the only person to listen to. I'm just saying that I trained at very serious academic medical institutions. I've been practicing medicine for 25 years. I see patients every day. I keep up with the guidelines. I also recognize the limitations of our current medical system. I'm going to go so far to say it's not just limitations, how broken our healthcare system is. So I started the Substack, to answer your question, during the pandemic. Actually started it just as a newsletter. It wasn't on Substack at the time, as a newsletter when in March 2020, we were all panicked watching the news, and I'm, processing all the information coming at us for my own health and my family's health, but also for my patients. So I started writing a newsletter every day for 90 days to help my patients and my family make sense of what was going on. And then it started catching on, and now it's reaching 38,000 people a week.
Right.
And I'm not talking about COVID anymore, thank God. I'm talking about how to make sense of this vast gray area between the 3 minutes you may or may not have with your doctor and what they recommend, and then what the wellness industry is telling you on Instagram and TikTok and in the news, because real life happens in the middle between medical guidelines and, we also want to be well. We want to be, we want to feel like we have a control over our health, but there's a lot of misinformation. There's a lot of pseudoscience. There's a lot of untrustworthy messengers out there in the medical space. So I'm trying to cut through the noise and just talk straight, like I do to my patients, like I do to my, my friends about health issues, because we all need help.
Yeah. I just read your most recent one. One of the questions from a listener or viewer or reader, whatever, was, should we still take baby aspirin every day? And
Right.
I have asked myself that question as well. So I kind of I opened it up and very curious, wanted to read, what is the protocol? Am I still taking a baby aspirin? And now people are going to say, what was the answer to that? So I better get you to explain what the answer to that is.
Well, let me explain to you what the answer is that it depends, right? And that's the whole point, is that it
Right.
depends. So it depends on who you are. I'll talk about the specific example, and then I'll talk about why that kind of question matters. Because medicine, when you're practicing medicine one-on-one, one patient at a time, the recommendations are going to vary widely. For example, person A may need to be on a baby aspirin every single day for heart attack and stroke prevention. Person B, who's the same age, may be recommended against taking a baby aspirin because they have a fall risk and they have a risk of internal bleeding. So the question of whether or not you should take aspirin every day completely hinges on your cardiovascular health, your bleeding risk, like the risk benefit ratio. I will say just more specifically, we used to say, everyone be on a baby aspirin because it prevents heart attack and stroke. And the newer guidelines are clear that there's a risk of aspirin just like there are benefits, and the risk benefit ratio is unique to the individual.
Mhm.
But the larger point here that I
Yeah.
think this question um, gets at is people don't have the space and the time to have those one-on-one conversations with their doctors to understand their unique risk-benefit ratio, right? They don't necessarily have space to interpret new medical guidelines when they come out, right? So there is no one size fits all,
Mhm.
prescription. Um, that's why you need a doctor, and that's why we need to talk. It's why my newsletter isn't like, here's what you should do. It's
Mm.
here's how you might think about asking your own doctor,
Mm.
because here's the set of contextual elements that go into the decision. Because what I see out there, as you I see too, I'm sure see too, is in the medical space of medical messengers who are doing public facing work. There's a lot of prescriptive advice from
Mhm.
doctors, like do this, do this, do this. And I'm not saying that all doctors are saying that, and I'm not saying that all of them are wrong either. I'm just saying that the inherent nature of medical advice is that it is nuanced. Of course, they're expert guidelines and they're sort of like, things you need to do, like and evidence-based things to do to like we know that smoking causes lung cancer. Smoking not good for you. Smoking is to be avoided. But even in that conversation, there's a way to help someone stop smoking that's not about shaming or blaming or spending 2 seconds with them. The point is that I think that sometimes doctors are overly rigid in their recommendations because they're just following guidelines. And then I think the wellness industry is sometimes overly permissive, like, oh, just because this person needs vitamin D, everyone should be on vitamin D, or just because hormone replacement therapy helps this person, that everyone should be on HRT, no matter the risks. When the truth
Yeah.
is that for any medical condition, any medical advice we give, it depends.
Hmm. Yeah, and that comes across very loud and clear in your posts, in your Substack, in your content on social media. I feel like that's where we see tension growing, is where we do see in social people being very like one size fits all.
That's right.
And then you get in the comments like the polarization, right? Like the arguments and the tension and the chaos. So I like what you're saying and what you're bringing across in your content, because it definitely is not one size fits all, and the importance of having a physician oversee your whole journey, but getting information and really empowering yourself through education and content like what you are providing for us. So I think that's great. What you're on a mission then basically to help us see the whole story. Where did this all come from in you? Like, how did you always want to be a doctor? Did you always want to
You're
work to empower people? What's your story?
you're so nice. Well, and my book comes out next summer with Simon and Schuster. It's called The Empowered Patient.
I'm excited to see that. I talked
Yeah,
about it
thank
in the
you. It's
intro.
The
Yeah.
Empowered Patient, reclaiming your, doctor's guide to reclaiming your health. So, I think that as a patient myself,
Hmm.
I have medical issues just like everybody else, or, different from everybody else. But I'm human is what I'm saying. Um, I've experienced emotional health challenges, physical health problems, like I am I am you. I am the patient too. And so I think in my own medical experiences, I have felt like many people do as a patient, unheard, not believed, misunderstood. People make assumptions about me. For example, when I was in medical school, I was at Harvard Medical School. I was a stressed out kid. So when I took myself to the doctor because I didn't feel well. I was having like hair loss and shaking hands and stomach upset, and like it was so obvious. It was like anxiety. It was an anxiety problem and depression. But instead I got sent to a neurologist for a brain MRI. I got sent to a rheumatologist for x-rays. I got sent to a GI doctor for all these colonoscopy tests, which all of which were normal, because the problem wasn't, that my organs were broken. It was that my thoughts and the thought mechanics needed help and support. I needed validation. So there's a reason why I'm very, very interested in promoting with every patient I see, every reader, that this notion that our brains and minds are inseparable, right? Like our bodies and minds are inseparable. The mental and physical health are inseparable. So like I think as a patient myself and as the sister of my brother who died from mental illness just last year,
Mhm.
witness like people get lost, even people with privilege
Mm.
and with intelligence and access, you know, it is so hard to be heard. It's so hard to know how to advocate for yourself in the doctor's office. And I want to be clear, I'm not blaming doctors. I'm not blaming doctors for not having time. I don't blame at all the doctor who saw me when I was at Harvard Medical School and suffering. They didn't have time. We didn't talk about mental health like we do now. If I had 5 minutes with that doctor, I was lucky. So I think that the system is broken, and I'm trying to help people who don't have the luxury of a physician and time with that doctor to arm them with the information they need or questions they may want to pose to their own doctor when they only have 5 minutes, and they got to be quick and they got to have prepackaged themselves before they enter that exam room.
Mhm. You said your brother got lost. Why do we get lost?
Well, I think the system is broken. Like, doctors don't have time. Like if you think about it, I mean, so doctors are incentivized to see patients in volumes, right? It's not based on outcomes. It's volume. And that's just the way the system is built. So if you're incentivized as a doctor, if you're trying to like, get through the day and do good work and care for patients, and you've got 10 people in your waiting room and you got 5 minutes for every patient, you just can't possibly address mental health, physical health, nutritional health, body mechanics, take my 80-year-old patient I saw last week who's on 15 medications. His wife just died. He's a fall risk. He's wants to know about traveling and vaccinations. Like that is not something I can do in five
Yeah.
minutes. And if I had to do it in 5 minutes, I would feel an intense moral injury and burnout. I've created a system. I have my own practice where I can take time with patients,
Mhm.
but that means people have to pay more. So it shouldn't just be for people who can pay for it that they have time with a doctor. And then people, I think there's also, I think, and this is where this is what I talk about in my book. I think the system is broken. And I also think as consumers of healthcare, as patients, we have very low expectations of what our doctors can give us. So we don't bring to the doctor
Mhm.
the fact that you have a toxic work environment or a difficult marriage, and that's why your alcohol intake is up, and that's why your weight is up, and that's why your blood pressure is up. But like sometimes you don't need a blood pressure pill or a sleeping pill. You need validation from your doctor that you have a marriage that needs some help, and you need a relationship coach to help you with the stress of your work. Do you know what I mean? Like
Yeah.
sometimes things are very simple. Like
Mhm.
I love the complicated cases. I love when things are, seeing the zebras, but, you know, we all have stresses, we all have moods, we all have relationships to food, alcohol, other people. Those inform our blood pressure, our
Mhm.
cholesterol, our weight, how we interact with other human beings. And that stuff is not something you can get to if A, you're not trained to talk to people about the human elements of being alive, or B, you don't have time. Or C, patients don't bring that to you in the first place because they
Yeah.
aren't socialized to think that that is relevant. People think of their
Right.
health checkup as like, I'm getting my cholesterol checked,
Yeah.
I'm making sure I'm not dying, and
Blood
then I'm on to the
markers.
next thing.
Yeah.
You know?
Yeah, it's those all inform the puzzle, don't they? Definitely.
Yes.
I like looking at it like that. So what's the solution then if a doctor does not have that time or the patient doesn't know to bring those elements? What do we do to reconcile that?
So two things.
Oh, you've
Well,
got
well,
answers. I love
oh no,
this.
no. I mean, I think about this all the time because I like
I'm
if
sure
you
you
think
do.
long enough about it,
Yeah.
you actually I could just curl up in a ball and cry all day long because it's so incredibly sad
Mhm.
what people aren't getting, even people with resources. So then you think about people who aren't resourced, who don't have a doctor, who are in the ER, waiting for hours and hours for something that a good primary care doctor could just help them with, right? Whether it's a mental health crisis or a pneumonia I mean, so the answer to the question is we need to reinvent the healthcare system. We need to
Mhm.
reinvent the healthcare system, not just to say we reinvented it. We need to reinvent it so that every American has unfettered access to a primary care medical home where behavioral health, mental health, physical health, and evidence-based medicine live. There's no lack of evidence in like medical economics that that is not only the right thing to do, it's the financially smart thing to do. It's just that in this country, there's no political will to do that, largely because of the hold that the pharmaceutical industry has on, you know, healthcare system and the hold that the insurance companies have. I mean, we have an insurance system that's not a healthcare system.
Mm-hmm.
We need insurance. We also need medications, but we not everything is done with a prescription. So, you know, my fantasy is to somehow be involved in a really not just like band-aiding the current healthcare system, but like really reinventing the healthcare system where primary care is the commodity. And so, you know, I may be dead before that happens, but I'm, you know, that's partly
Yeah.
what I'd love to do in my life with what I see and what I have experienced with my own patients.
Mm-hmm.
And then the second thing is read my book, to have the owner's manual to being a patient, to say, here's what you need to bring to your doctor, given that the
Mm-hmm.
system's broken and she or he has 5 minutes with you. You know, here's where you may find more information about this subject. Here are the set of questions you might bring to your doctor to talk about, is it time to get a second opinion? And even broader, here's a framework I'm going to teach you about to conceptualize your health in a broader way and to think of it as more than just the sum total of your labs. Health is about it's a process. It's about awareness of your medical data, which includes your biographic data, like were you born the child of an alcoholic? Did you grow up in poverty? You know,
Right.
did you have some traumatic experience in childhood? All those things are relevant to your adult health. And then you know, how do you process grief? How do you process stress? You know, what's your relationship with food like? Not just are you eating your broccoli? Um, and so let's put a broader definition of health out there so then you can think more broadly about how the different parts of your health ecosystem talk to each other so you can then be your own advocate every day and then in the doctor's office.
I really like where you're going with all of that. My background's in psychology as well, so I always
Mm,
look through like it in fitness through the lens of psychology. I'm always asking, not just what is the exercise protocol, what do I eat to lose body fat, but it's the why behind it as well, and really exploring all of those pillars. I've heard multiple times from you already that therapy could play a part, or this wellness component could play a part in our overall health and wellness. Talk to us about how does therapy, mindfulness appropriately come into the picture in terms of our overall health?
so I love that question, Tracy. So here's how I think about mental health. Mental health is an intrinsic part of one's whole health.
Hmm.
So you know, you could talk about having good mental health, you could talk about bad mental health. I mean, but the point is, or fritzing mental health, right? But the point is that we all have mental health. Like you have it. You can't opt out of having mental health unless you're like ChatGPT, right? Like you're a robot. Like you have mental health, whether you're skipping to work every day or whether you're in the depths of depression. You have mental health. So the question
Yeah.
isn't, do you have mental health? You do. The
Yeah.
question is, where do you live on the
Mhm.
continuum
Mhm.
of different elements of mental health? On the continuum of anxiety, are you at baseline like a 5 in terms of reactivity and overthinking and emotional lability and catastrophizing? And how far up that continuum do you travel when you're on an airplane and there's a turbulence? And then what tools do you have to bring yourself back to your baseline? And
Mhm.
is your baseline comfortable? Is your baseline anxiety level interfering with your quality of life, interfering with your relationships, interfering with your relationship with alcohol or food? Is it clogging up so much brain space that your anxiety, while it may be your baseline, is too high? Same thing with continuum on mood. Same thing with continuum with relationship with food, alcohol, interpersonal effectiveness. So the point isn't that we need to diagnose everybody or stamp red labels on people, and that's for diagnostic coding for insurance billing. It's the question of where are you in your kind of self-awareness about the elements of your mental health? And then the next question is, are you okay, which is the title of my newsletter. Are you okay with where you are? Are other people okay? Are you healthy mentally and physically with the level of anxiety or the level of, you know, your baseline sort of mood where you live when things are stable in your life? And if not, what are the tools you need? And the tools can vary person to person. Some people need to be in AA. Some people need to be in psychotherapy. People need psychotherapy and AA. Some people need a therapy is like a support dog. Some people need just a daily mindfulness practice, not because there's something wrong, but because they want to practice
Mhm.
being in the present moment
Mhm.
and not catastrophizing about the future or living in the past, simply to feel well, to lower their blood pressure, or just to enjoy inhabiting their own body and mind. And so the tools that we deploy to help people manage their mental health, whether it's good, bad, or in the middle, depend on the situation and depend how much people, you know, need and want.
Mhm. So you see hundreds of patients every week. Are people by and large okay, or are we not doing okay?
I would say this, Tracy, like, I mean, especially if you're in my office, because I elicit these kinds of conversations. Like I tell people all the time, they're like, "I'm sorry, I'm crying." I'm like, "Oh my gosh!" Like I'm inviting you
Please
crying
do.
because I'm asking about your
Mhm.
death of your mother and
Yeah.
how you were fired
Mhm.
from USAID, and I'm in the District of Columbia, right? So there's a lot of despair about you know job losses and the government shutdown. So the answer to your question is I think human beings are extraordinarily resilient. I also think we're living through a very difficult time culturally, socially, politically, and I think it's normal to feel that in our bodies. It has to go somewhere, right? It reminds me a lot of the spring 2020 when the pandemic hit, where I was seeing a lot of patients with the physical manifestations of emotional distress, from migraine headaches to low back pain to sleeplessness to, elevated liver function tests because people are drinking alcohol and those,
Mhm.
quarantine days, and didn't take a genius to realize that a lot of it was stress, not to dismiss it, but to rather to say, let's honor the fact that this is a normal reaction to sustained stress. So I do see that quite a lot right now.
Mhm. Yeah. Um, Our audience is the woman in menopause. That's
Yeah.
our typical woman here that's listening to this podcast. I would love to hear what are some of the things that what are some of maybe the unsexy fundamentals that we need to begin to prioritize in order to feel well, in order to, when we come into the doctor's office, we're, maybe not catastrophizing. We're coming with the basics. We're coming, maybe needing to get our checkup or whatever, but we're coming in okay.
Yeah. So middle-aged women in menopause, by the way, I am that person,
I am as well.
is one of my favorite sort of age cohorts. And the theme I would say that I share with patients is that you have so much more control over your sort of journey, if you will, through menopause and your aging process than you think. Like
Mm,
it's not inevitable that you're going to be hot flashing and night sweats and miserable and have no sex life and gain weight and get chin hair and just be frail and get bone fractures and die. Like you have more control over your health than
yeah.
you think. And middle age is a perfect time to really start investing in your health if you haven't already. It's never too late. First thing first, hormone replacement therapy. It's abundantly clear from the totality of evidence we have on hormone replacement therapy that if you start HRT, hormone replacement therapy, menopause hormone therapy, in the first 10 years after a woman's last menstrual period, that people do better in general.
Mm.
Bones, heart, and we think
Vasomotor
cognitive health. And
symptom.
we, and
Yeah.
we think cognitive health. Not to mention like improving the genitourinary syndrome of menopause, urinary frequency, pain with sex, vaginal dryness, pelvic floor dysfunction. It's not to say that everybody should be on hormone replacement therapy. It's to say that the evidence shows that in if you take cohorts of women, large cohorts of women, and you randomize them to either taking HRT or not, in general, people do better on HRT. So therefore, when I see a patient as an individual who's 52 and hasn't had a period for a year, we're putting her on HRT unless there's another reason not to, which includes patient preference.
Sure.
So HRT, like, I think very, very soon we'll see if it hasn't happened already by the time this is put out, the black box warning on
Yeah.
vaginal estrogen will be removed,
Perfect.
thankfully,
Okay.
finally,
Yeah.
because vaginal
Yeah.
estrogen is safe. And then systemic hormone therapy is wonderful for all the things I just talked about.
Hmm.
We're seeing a lot in the Instagram, TikTok space about strength and muscle tone and the benefits of lifting heavy weights. That was not something we talked about when I was in medical school or even
Yeah.
right? But we know that people lose muscle tone, muscle mass with age. It's harder
Yep.
to maintain muscle mass as you age. So you have to do some strength work. Doesn't have to be fancy, doesn't have to be formal, doesn't have to be, prescriptive. It just has to be done to maintain muscle for fall prevention, balance, and for metabolic efficiency. Number three is protein in your diet. Everyone hears about protein all day long, but it's true. I don't go by grams of protein because I think that to organize your day around counting protein, it can be exhausting. I would just say eat 3 meals a day
Yep.
and have protein with every meal.
That's right. Yep.
Like, you don't need
And
to
then
go
you're
like
winning.
hunting and gathering everywhere you go. Just eat protein with every meal if you can. Also, vegetables and fiber and healthy fats, and
Hmm.
quit drinking if you can. Alcohol is a wonderful thing. I love it myself. It was my birthday recently. Of course, I'm going to have alcohol, or at least I should say, of course, I am going to have alcohol because I don't have an alcohol addiction and I like it. Um, but alcohol is just a neurotoxin. It affects our sleep, it affects our mood, it affects our brain health. Like, there's nothing medically good about it, except for the fact that it's fun and in the right person, it's okay. But if you have a wobbly relationship with alcohol, you want to think about it.
Yeah.
And then human connection, right? We live in an era of isolation and disconnection, particularly post-pandemic, particularly when you're middle-aged, your kids are older, and you may not see all those friends on the sidelines of the soccer field. You have to work harder to see friends. I've
Hmm.
noticed that too. So make sure you maintain your community. Make sure you make date nights with your girlfriends or whoever. Um, and then get your checkups. See your doctor. Get your colonoscopy. You should get it at 45. Get a mammogram every single year. If you have dense breasts, ask your doctor if you also need either an ultrasound or a breast MRI in addition to the mammo. You need a gynecologist. Just because you don't need a pap test every year doesn't mean you don't need a gynecologist. I get
Hmm.
that question every day. Just because you
Yeah.
don't need a pap test to screen for cervical cancer doesn't mean you don't need a gynecologist.
It's a bit
Uh,
different here in Canada. With that, I live in Canada. I don't know if you knew that,
yeah,
but yeah, we have to be recommended to a gynecologist. We can't just have one. You can't just go and get your own like we do a doctor, and we can't change doctors. It's very tricky in the medical system up here in terms of that. But if you have something like I had an IUD put in, and so
yeah,
I was able to get a gynecologist for that, and now I have one, but
yeah.
my sister doesn't. So it's like,
Yeah, I
how do
mean,
you,
it
you
depends
know,
on what kind of like one of my partners does gynecology and internal medicine, so her patients don't need a separate gynecologist. But I'm going to acknowledge that I cannot feel someone's ovaries to save my life, and so
yeah,
if somebody has a history of ovarian cysts or something, they need a gynecologist.
for sure.
And then skin checks because skin cancer is sneaky. It's also like low-hanging fruit cancer screening. It's a visual, so it's not like you have to do anything invasive to be screened.
Hmm.
And then, in the sort of spiritual, metaphysical sense, like as we get older, I think it's always a good time to re-examine priorities. How are we allocating our precious resources? Money, time, and brain space. Those are finite.
Hmm.
Many of us have children and parents, some of whom are struggling, some of whom aren't. Maybe we have our own health problems. It's just a good time in our middle age to think about where we are allocating our precious time, energy, and money because, we aren't going to live forever. And you want to make sure that you're thinking intentionally about quality of life and quantity, of course, but quality of
Hmm.
life, which is sometimes we don't think about until we get some bad news.
Yeah, it's interesting. This stage of life really does allow those moments to really contemplate that because maybe we're empty nesters, so we have more time to ourselves in our brain, right? Our brains aren't running a million miles a minute with the kids' schedules and what they're doing. And so we are faced with a lot of these things. And at the end of my workouts, I always get quite contemplative, sharing during the stretch session. And I know a lot of the women are like, "Oh, I love that you shared that." And I'll just be authentic and honest and just share some of the things that I'm going through. And it's interesting because I don't feel like 10 years ago I was really thinking in that space. And so I enjoy uh considering, my reason for being, even my purpose, my worth, all of those things, and then just sharing my thoughts and feelings about that too, because yeah, I think a lot of us have it because I hear in the comments, "Oh, I'm so glad you shared this because I'm in the same spot." So
Yeah. I think it's so great that you do that, Tracy. I think it sounds like it's intuitive for you. It's not like it's an effort to like,
yeah. Yeah.
oh, today I'm supposed to share something authentic. But I think if you think about what are the ingredients for, healthy relationships, it's, shared vulnerability.
Mm-hmm.
Doesn't mean you have to share your dirty laundry or like start, gossiping about it just means like, the authenticity of how you're doing
Mm-hmm.
and sharing that with the people you're with and also listening, right? Listening is also the other half of that
Mm-hmm.
equation in any relationship. But I think, in an era where we are so disconnected or can be from other people and where there's so much of a focus on appearance and, sort of the snapshot Instagram, like highlight reels of people's lives, I think people are starved for a sense of connection and understanding and feeling understood by other people.
Mm-hmm. Well, and I think when we can do that, I'm thinking back to your time when you're at Harvard and you're in school and you're having all of these stress, anxiety induced symptoms. And the doctors are like, okay, let's get the brain scan, let's get your guts tested, let's get, all of the physical things. But honestly, if they had just taken that moment to say, what is going on inside of you and what's the story that you're telling yourself and how can we explore that? Not that they had the time to do that. And I understand, but even like if ourselves, like knowing ourselves and getting to know ourselves better and understand our own reactivity and why we're thinking the things that we think or doing the things that we're doing, and beginning to have those conversations with maybe not the world, but maybe with some close friends and just saying, these are some of the things I'm feeling, because that plays out in our body so often, doesn't it? I'm sure you see that all the time.
Every day. I mean, literally
Yeah.
every day. Yeah, and it's not to say that we're all like mentally ill or like victims of our own brain chemistry. It's to say that this is how human physiology is.
Right.
And so, yes, you're right. The stories we tell ourselves,
Mm-hmm.
they are, if you think about the chatter, right? Like the inner critic or sort of the assumptions you make about, why this person, said this to you or emailed you this way or didn't put an explanation point on their text. Like the stories we tell ourselves, there's so many. That we make assumptions all day long. We have to, otherwise we'd be like that's like we're like a newborn baby, like trying to learn like patterns. But the stories we tell ourselves really are sometimes completely wrong and
Mm-hmm.
completely inaccurate, right? Like how many patients do I have, women in particular, who have sort of a self narrative of like unworthiness from some that comes from some place. Maybe they had a critical parent or they had a unhealthy marriage and they were for whatever reason, or maybe they literally just are self-critical, and how that plays out in their sort of health habits or their relationships or at work. And so you're absolutely right, Tracy, that the ability to step away from our conscious lives, like the sort of like what we're doing and saying and thinking right now, and to like delve into the unconscious life, like and look at what the narratives are, and like try to then say, hey, like that story isn't actually true, or maybe it was true at the time. Like maybe it was true that I needed to be a vigilant person when I lived in a chaotic household, but now I don't need to be vigilant and question other people and be anxious all the time. Like that self-awareness, that sort of attempt to merge the unconscious and the conscious mind is
Mm-hmm.
really, to me, the essence of being alive. And I talk about that in the book. I have a whole section on consciousness and cognitive health, from like dementia to like spirituality, because like, why are we alive in the first place, right? It's not to have perfect cholesterol levels. Like, that's great. It's not to like amass all the money you can in the world. That would be nice. If you ask anyone at the end of their life or towards the end of their life, or even if they get older, like why are you here? It's usually about relationships and connection and sort of a sense of purpose and meaning. And it's never too late to sort of mine the depths of your inner world to understand what that means for you.
I really appreciate and see that emotional intelligence in you. So how do you do that? How are you doing that actively on a day-to-day or year-to-year basis?
Oh gosh, I'm probably the worst. Like I'm the person who's like, I don't have time to meditate. You know what I mean? I'm the person who says that. Like I like so like do
You're
as I
like,
say,
go
not as I do.
meditate, but I
Right.
don't.
Like
Yeah.
everybody else should meditate except I'm fine because I don't need to. No. What do I do? I mean, I really like I lost my brother last year, which was a major, major deal for us, for my family. It also has taught me a lot. I mean, I've been on this sort of path of like self-discovery for a long time, in part because there's mental health issues in my family, like there are in so many families, and in part because I was trying to figure myself out, and in part because I think that's the most interesting part of humanness. Like I remember
Mhm.
my favorite class in medical school was called Patient Doctor, where we had to interview these actors they hired and pretend they were patients and then like deliver really bad news. And so you had to quickly create a rapport and then tell somebody awful news. And everybody hated it. And I was like, oh, this is great. So what do I do in my regular life? I mean, I go to yoga. Sounds cliche, but it's a 3,000-year-old cliche for a reason. I go to
Mhm.
yoga and I literally like metabolize stress. I metabolize like the grief that I've experienced over
Mhm.
the last year. I metabolize just work stress on the
Mhm.
yoga mat.
Mhm.
I go once a week. It's not that much. It used to be 3 times a week. I'm going to try to get it back in 2026 more. I spend a lot of time walking and talking with girlfriends. Like that is my favorite thing. On a weekend,
Yeah.
put on our sneakers and we just walk. And sometimes we'll get
Yeah.
lost and we're like, oh my God, it's like we've been walking for 2 hours. I prioritize sleep. I eat healthy. I'm writing this book, which has like been my passion project for like it's been coming out of my pores for probably 20 years.
Hmm.
And then much nicer to myself than I used to be. I'm like the classic, like recovering perfectionist, like so cliche. And I've just learned about my own inner critic and how like ridiculous it is and how I would never talk to anybody as critically to them as I do to myself. I mean, that's been a long time. Like, so just seeing the benefits of having done a lot of therapy and
Yeah.
releasing myself from like, you know, rules that only I wrote and no one ever wrote except me and that were just rigid and ridiculous has
Mhm.
been liberating. And I'm still a work in progress. Like I still get anxious and I still get edgy and I will snap at my husband even though he's the best guy ever, but sometimes it's annoying. Um and and so yeah, I'm just a work in progress like everybody else. But thank you for asking. It's a nice question.
Mhm. Yeah, it's funny because you do think that you've done all this work, and I feel like that about myself too. Gone to therapy, do introspection, meditate, like all the things that you've mentioned, and then you'll have a moment and at least now I can pop outside of myself,
Yeah.
observe that, be curious about my reactions, and bring some compassion. Maybe not directly in the moment, I might be a little self-critical, but that is the work, right? That's the work. And I think so strongly that it's such an important part as our growth, of our growth as women in this stage of our life. It's not just our physical health, though that is crucial as well. But if you just focus on the physical without paying attention to the mental, I think we're going to suffer a little bit more than we have to.
I think you're right. I think denial is a powerful force. I think it's hard to peel back the layers. Um, Sometimes you don't see things you like very much, right? Like when you face the uncomfortable truths about things you've been telling yourself for 30 years or a relationship maybe needs to change or so it can be hard. But I think you're right that there's a lot of value to doing that. And I think, I'd love it if, mental health was more, I mean, I think it's much more widely acknowledged as relevant to physical health,
Mhm.
but still there's still this notion that like mental health means you're mentally ill or that like, and then of course the fact that insurance companies don't always pay for therapy, you know, sends the message loud and clear that it is a luxury item, that it's not,
A
like, why
normal
would they pay
everyday.
for a cholesterol check but not a
Right.
depression check? So
Sure.
we have a long way to go, but you're right.
Yeah.
It matters.
I know we've been talking a lot about that emotional, internal stuff. That's my wheelhouse. I really enjoy talking about that, but I would be remiss if I didn't ask you some questions that people have said, make sure that you ask her this. So,
Please, 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 please.
I do want to talk a little bit about blood pressure and cholesterol. These are two markers that we can definitely look at. And what a lot of people have noticed, and I've heard this from our audience, is that often people will get a little bump in their LDL cholesterol, maybe in menopause. Sometimes we see our blood pressure rising. So let's talk about that, those two things specifically. What's
Great.
happening physiologically, right? And what are maybe some good ranges that we need to aim for?
I love that question. So blood pressure and cholesterol are two, values we want to understand in every adult, even sometimes in children, but high blood pressure, and we could define what that means in a second, but high blood pressure and high cholesterol are independent risk factors for the development of atherosclerotic heart disease. So the phenomenon where there's stickiness of cholesterol particles, fat particles that stick to the insides of arteries that supply blood to your brain and that supply blood to your heart. So hypertension, high blood pressure, and high cholesterol are two of the biggest risk factors for vascular disease, heart attack, stroke, vascular dementia.
Mhm.
Um, there are other risk factors, cigarette smoking, diabetes, family history. But if we're talking about those two things, it's important to recognize that for both blood pressure and cholesterol, there are fixed elements to those readings and there are dynamic elements to those readings. And where I'm interested in talking to my patients is educating them on what is fixed and what they can't change
Okay.
and what is dynamic, right? Because you can't change, for example, a genetic predisposition to high cholesterol or a genetic predisposition to high blood pressure. Some people just have it in their family.
Right.
You also can't change your age. So if you have every person in your family, regardless of gender, in their 70s developed high cholesterol, you may be more at risk for having high cholesterol in your 70s. That doesn't mean that there's nothing you can do. It just means that that is a factor.
Hmm.
So if you look at the things where you do have control, that's where the fun is, so to speak. That's where you have agency. So blood pressure, let's talk about blood pressure for a second. Blood pressure, a normal blood pressure is in the 120s over 70s to 80s. 120s on top, 70 or 80s on the bottom. What are reversible reasons for high blood pressure readings in the doctor's office in the moment or over time? Salt intake, regular alcohol use. I don't mean like one-time alcohol use, regular alcohol use, um, emotional stress,
Hmm.
metabolic insufficiency, so like obesity, um, relative inactivity. So the way to then bring blood pressure down, if you have high blood pressure readings, is to limit salt, limit alcohol, get exercise, work on your metabolic health, prioritize sleep and stress management.
Hmm.
I am not saying, Tracy, that if you have a genetic predisposition to high blood pressure and you're 70, that changing your lifestyle and getting more sleep is going to reverse your blood pressure. I'm saying
No.
that that's what you can do.
Right.
Are there patients who have reversed their high blood pressure despite genetic predispositions through rigorous exercise, healthy eating, quitting alcohol? Absolutely. The key is knowing just where you have no control and where you have agency.
Hmm.
Because what I see all the time, for example, is patients who are like trying to you know, add more exercise, add more protein, add more fiber, get more sleep, track their sleep to get off their blood pressure medicine when it's really just a genetic thing. And they need to
Hmm.
be on blood pressure medicine to not have a stroke.
Right.
And then you see the other way around where people are like on all these medicines, like three or four different blood pressure medicines when no one ever told them, if you just cut the salt back and you got like another hour of sleep and maybe you left that really toxic job where they're killing you, like maybe you would need one blood pressure medicine.
Mhm.
Does that make
Yeah,
sense?
and that's excellent. That's really good. I'm just thinking, my husband has high blood pressure and has been fit and healthy his whole life. He was adopted, so we don't know his genetic background, but he's had to go on blood pressure medication for years now. And again, lean, fit, healthy, stress might be up a little bit, but no smoke, no drinking, and still. And then our
Yeah.
son also now has developed it, and he's also a trainer, and he's fit and healthy and doesn't smoke, doesn't drink, and so I'm like, that sucks for them. Like,
It
but
does.
it could be. And my mom has, so yeah, genetics plays a part. What are you going to do?
Genetics are not destiny, but they play a role, right? And so you
Yeah,
just have to know to what extent is there a reversibility, and not try to reverse something you can't reverse, because that takes a toll. And then to what extent is it fixed? And that's where, the longitudinal assessment of blood pressure really matters, right? Because someone who embarks on an exercise program and loses 20
yeah,
pounds and then their blood pressure is still high, that's more
yeah,
evidence that it's not to do with exercise, that it's
right,
genetic. And so,
yeah,
and being on medication for blood pressure isn't a failure, it's meeting the moment, right? And 50 years ago, people had strokes more than they do now because we were really keen on making sure blood pressure is controlled.
hmm,
And then in terms of cholesterol,
yeah. Let's talk about
there
that.
are fixed genetic elements to it,
Okay,
right? Like some people have familial hypercholesterolemia. Some people get higher cholesterol as they age. It is absolutely true that some women, not all, will see a bump in their LDL and total cholesterol levels as estrogen levels fall as they go through menopause. It's not universal, but it's common. And then on the other side of the things that you can reverse, well, you can start taking estrogen, so that could be considered reversible. But um, are, diet, exercise, metabolic health, and specifically in diet, what are the things that tend to elevate cholesterol levels? It's the red meat, it's the fatty, prepared meats, and it's high
saturated
fat
fat,
dairy. It's not eggs. Eggs are fine. Eggs are a superfood. It's
cheese.
processed and prepared foods. It's shellfish. But there's a lot of thinking, the newer thinking that is that it's not really like, sure, there are patients who eat a crappy diet and they cut out all the sausages and, charcuterie, and their cholesterol normalizes. But diet isn't the whole story when it comes to cholesterol. It's diet, it's it's your lean body mass, it's your um, insulin sensitivity, it's your how much you exercise, and then it's hormonal. So it's not that starting estrogen or starting HRT is a way to like treat high cholesterol, but certainly normalizing estrogen levels through
Mhm.
taking HRT can help some women's cholesterol levels go back to where they were pre-menopause.
I had a friend who her LDL was up, and her doctor put her on a low dose of Monjaro for
Uh-huh.
cholesterol. Is that something that's being? I had never heard of that. I was like, wait,
Well,
what?
yeah. I mean, here's the thing. The GLP-1s, which is the other hot topic of the day, and a topic that's here to stay. The GLP-1s, um, their mechanism of action is exquisitely elegant. It helps with metabolic efficiency. It helps with insulin ability to work. It helps with insulin sensitivity, that is. It helps people with weight loss. So to the extent that cholesterol elevations are the result of
All of those things.
overeating, like insulin insufficiency, and then, because people just eat less. And
Yeah.
then when they've lost 20 pounds, they're more motivated to eat healthier, and they also don't crave fatty foods as much. I mean, it sounds like I own stock in Novo Nordisk, or that I'm like an agent of Eli Lilly. I'm not. I kind of wish I did own stock in those companies, but
Yeah.
they really are. They're really sophisticated. So, for example, I have a patient I saw this week who has coronary artery disease, so plaque in her coronary arteries, as a combination of she smoked in her 20s and she has some genetic high cholesterol. She's postmenopausal, but on HRT, blah blah blah.
Mhm.
She needs to lose 20 pounds. She also needs to be on cholesterol medication because the cholesterol medication itself, independent of the cholesterol levels, helps with the coronary disease. It helps stabilize the existing plaque. And when you have coronary artery disease, your goal LDL cholesterol is stricter than if you didn't have coronary artery disease. So anyway, so she is on cholesterol medication. Her cholesterol though is higher than is at goal. So instead of increasing her cholesterol medication, I'm putting her on a GLP-1 to help her lose some of the weight
Mhm.
and prediabetes, which will then we'll just see what her cholesterol looks like after it. In other words, if you're it's one of the root causes of high cholesterol,
Mhm.
but it's
How
not a
important?
cholesterol drug per se, if that makes sense.
Yeah, no, I understand the mechanism there. How important? So I just got a blood test back, and triglycerides and HDL were looking good, but yes, my LDL in all my blood panel, that was the only thing that was out of range, and I was like, "What? How
So
could it be?"
let me speak to that for a second because people obviously people patients get their lab tests like right they see them they read them online and if they see a red flag that's the thing they look at.
Of course.
Your cholesterol may be high, but just because LabCorp or Quest or whatever company is running your labs flags it red doesn't mean it's actually high for you. What do I mean by that? The target LDL goal depends on who you are. So my patient who has coronary artery disease, we need that LDL to be under 70. But
Mhm.
if you're a healthy person, non-smoking, has normal blood pressure, non-diabetic, an LDL under 100 is great. If it's up to 130, that's okay. It depends on your other cardiac risk factors. So, in other words, there's no context when you just are reading your own LDL number. It's not to say that something that's flagged red isn't worthy of your attention or that we're blasé about cholesterol levels. It's simply to say that just because a lab says this is high doesn't mean there's a medical intervention that needs to happen. So you
Mhm.
just want to see your doctor and apply the context to it. It's not a one size fits all recommendation. Like there's no mortality benefit to driving your cholesterol down under 70 if your LDL is 109, for example. So
Mhm.
that just causes it. Does that make sense?
Yeah, yeah. No, when you see that, you're just like, how do I fix it? How do I
How do
fix
you
it?
fix it? But sometimes it doesn't need to be fixed, right? Like sometimes it's just oh, LabCorp just needs to change their scales and understand that you aren't someone who has diabetes or hypertension. They're trying to not get sued,
Yeah,
and by flagging people, everybody the same, right?
yeah. I will finish off with this question. If you could give every 50-year-old a message for the next decade of her life, what would it be?
It would be to do the very hard work
Hmm.
of understanding where you have control over your health and where you don't, and the
Hmm.
difference. It's kind of like the serenity prayer of health.
I like that.
So this is what not to over promote, but it is what my
It's
book
what,
is about. It's about
yeah.
health as a process. It's about the three A's. It's about awareness of all your data from your LDL cholesterol to, the story that set you up for this narrative of, unworthiness in your life. Like
Mhm.
those are the set of facts that you need to have access to and understand
Mhm.
how they inform your health in a broader sense. And then the next step is working on acceptance of the things you can't control. You cannot control that you have a genetic predisposition to things like breast cancer or cholesterol or heart disease. Like genetics are things you can't control. But what you can control once you're done, although you're never done accepting the things you can't control, once you're aware at least of the things you
Sure.
can't control, then you can allocate your energy to areas where you do have control. If you have the genetic predisposition to breast cancer, then you're going to maybe decide to be more aggressive about screening. Or maybe you're going to have a mastectomy so you don't worry so much about breast cancer. That's, of
Mhm.
course, a very individual decision. Or maybe you're more intentional about your eating and alcohol use because you have the family history of heart disease. So the message is, in short, try to understand where you can, where you have, fixed realities that you may or may not like, and where you have agency. And that really requires guidance. It really requires more than, reading one book or getting a set of labs. It requires sort of a deeper understanding of what it means to be healthy. And that is, you can get through lots of different places through your doctor, through you, Tracy, if you're, you know, listening to this podcast, through, other medical and health experts who are credentialed in the things that they are counseling people about and who are, you know, promoting evidence-based, science-backed, recommendations, and people who, the ones I trust are people who are humble about what they don't know. So, be careful about who you listen to, but also try to find a village of people who can help you flesh out your sort of palette of medical pieces of information that define your health ecosystem and your
Mhm.
goals.
And then you will become the empowered patient, folks. The empowered patient. That is the name of Lucy's next book coming out. Did it say it said 2026? But when is it coming
Yeah,
out?
August 11th, 2026. It's coming
Oh,
out.
good.
Yeah, so just in time for like the back to school and like sort of,
Yeah.
I don't know. I always think about back to school as the time to like, even
Oh,
though
yeah.
I'm not in
Doctor's
school,
appointments, get all your
yes,
things done. Yeah. Get your
get,
tests in. Me too.
get your new loafers, get your new pens and pencils.
Get your blood drawn. Yes, all of that sounds great. Lucy, where can people follow you and talk to us about your Substack as well, how they can subscribe to that?
Thank you so much. So you can go on Substack. It's you can or you can just Google Lucy McBride MD. You'll see my Substack, you'll see my own website, and I'd love you to read my Substack. It's free. I write a newsletter every Tuesday, and then I do Q&As, reader Q&As on Fridays, and it's a lot of fun. And it's helped
Mhm.
me understand, beyond just the walls of my office, just how lost people are and just how low the bar is for, you know, people
Mhm.
feeling glad to they're like, thank you so much for answering my question. Like, I'm like, oh my gosh, I can't believe that I had to answer that for them, that they don't have someone they can ask in their life,
Mhm.
like a doctor. But so yeah, Substack, it's my name.
Instagram?
Instagram, I'm on Instagram. I'm on all the social media platforms, not TikTok yet. I don't know if I'm game
Don't.
for that.
I mean, you can, but
I haven't done it
it,
yet.
it's a different audience. I actually did quite well over there initially. Like if you put anything out that's like, but now, yeah, the audience is just different. It's funny. It's a different audience. It's an audience that wants to just complain in the comments sometimes. I don't know. And I've been on there for years, so that's just my experience. But anyway, Lucy, thank you so much for joining me here today. That was really wonderful, and I really enjoyed our conversation. So thank you for coming.
And thank you, Tracy, for having me. I really love your work. I've been looking through the things you're putting out there, and it's meaningful and it's valuable, and it takes a village to help
Absolutely.
a single person. So thank you.
All right, thank you. And to all of you now, go move daily in your fitness, your wellness, your nutrition, and we'll see you all in the next Move Daily Talks.